Hey guys, welcome to my YouTube channel. It's Miss here and I am back with another video. So today I am doing a video on lower abdominal pains, and I have been wanting to do this video, but I've just been putting it off for a very long time. I don't know why. I guess I just was not satisfied about what I have in terms of like the information. I've just been putting it off. I guess I haven't really been giving it time, but now I am here and I am doing this video on lower abdominal pain. So the reason why I actually wanted to do this video is because a lot of women experience this kind of pain, the lower abdominal pain, and a lot of them do not know what is actually causing it. And some of this pain is acute, which means it comes suddenly and it probably goes away. And then some of the causes of this pain can be chronic. So it's chronic pain, which means that it is long lasting, it goes on over a period of time. And some of the things that cause lower abdominal pains actually cannot be treated. Some of them do not have treatment, and some of them, it's things that you have to learn to live with. So yeah, man, that's what has motivated me to do this video on lower abdominal pain, and I will be focusing solely on women, right? The causes of lower abdominal pains in women, especially women that are in their reproductive years, around your age of 18 to 35 or even going up to 40. And I'm only going to be focusing on the gynecological causes. So anything that has to do with the woman's reproductive health system, those are the things that I will be talking about. So if you're a woman and you are in your reproductive ages between the ages of 18 and 35 or even up to 40, then I suggest you stick around and watch this video. And if you do like this video, please give it a thumbs up. Please subscribe to my channel. Please click on the notification bell so that you are always notified when I post a video. And please do share this video because I really think that it's going to be informative for a lot of people and it will help a lot of people. So without any further ado, let's get on to the video. And you know what, guys, I must say thank you so much to everyone who has been watching my vlogs. Thank you so much, guys. Like, the warm reception my vlogs have received is just so amazing. It makes me so happy, and I'm so excited to see that you guys actually do enjoy that type of content too, because I really do enjoy doing vlogs. So I'm definitely going to keep up doing vlogs, but my sit down videos still have to be here, okay? Because that was the whole purpose of this channel, to teach you guys, to educate you, to empower you. So thank you so much for loving my vlogs and watching. So before I talk about the causes of lower abdominal pain, let me maybe have like a brief summary, or give you guys a brief summary of a woman's reproductive system, right? So I'm going to put a picture up here. So a woman's reproductive system is made up of a woman's vagina, which is the tube that's from the outside of a woman's body, which goes into the woman's womb, right? So the reproductive health system, it's made up of that vagina, which is the muscular tube, and the uterus, which is the womb, and it's the one that houses the baby when a woman is pregnant. And then coming out or extending on the sides of the uterus, it's the fallopian tubes, and that's where the egg travels, which is the egg that will be fertilized when a woman conceives or when a woman falls pregnant. The egg will be fertilized by the sperm so that a baby can grow out of that fertilized egg. So we have those fallopian tubes which transport the egg, and on the sides of the woman's body we have the ovaries, which are the organs that produce the egg that will be released, that will be fertilized in order to cause a pregnancy, which will house itself in the uterus, which is the womb, right? So that's basically a woman's reproductive system. And all of the things that I will be talking about in this video are related to that system. So the things that I am going to be talking about in this video that cause lower abdominal pains are: number one, sexually transmitted diseases or infections, otherwise known as STI. Number two, pelvic inflammatory disease, which is also called in short PID. Number three, endometriosis. Number four, ectopic pregnancy. Number five, ovarian cysts. And number six, fibroids. So those are the things that I will be talking about in this video that cause lower abdominal pain. And if you do not know where lower abdominal pains occur in a woman's body, let me go up and do a small young demonstration for you guys. So lower abdominal pains usually occur around this area. So around the umbilicus, this is like the area where a woman has lower abdominal pains, over here, right? But yeah, like that's mostly the area where women will experience these types of pains. So that's the area of your lower abdomen, and that's where you would have lower abdominal pains. Okay, so the first thing that I said I would talk about is sexually transmitted infections, and I did talk a bit about sexually transmitted infections in my video that I did on vaginal discharges. I will link it up here. Please go and watch that video. It will really give you more information on this topic of sexually transmitted infections and how they can change your discharge and make it abnormal. So sexually transmitted infections, and particularly infections like your gonorrhea and your chlamydia, those are the two types of bacteria that are sexually transmitted that can cause you to have lower abdominal pain as a symptom. So what happens is that if you get one of these bacteria from a sexual partner, if you are having unprotected sex, meaning sex without a condom with someone that has the infection, then you can now have this infection. And what it does, it causes inflammation in your vagina, and it causes your vaginal cells to secrete this discharge, which will be green or yellowish, which will smell bad. It can make your urination burn, so when you are peeing you can have a burning sensation, and it can also cause you to have itching around your vagina or painful sex. So those sexually transmitted infections, if they are not treated, they can end up going up your reproductive system, so going up from your vagina up into your uterus or your cervix before they can get to your uterus, and they can cause you to have lower abdominal pain. So very important, don't ignore that pain, lower abdominal pain. It can be like a dull pain. It maybe can feel like period pains. It can be pain that comes and goes, and especially if this pain is associated with a foul smelling discharge that is perhaps green or yellow, then you definitely need to have that checked out. You have to go and get antibiotics, and you need to practice safe sex, which means sex with a condom. And then the second thing that can now cause lower abdominal pain is pelvic inflammatory disease, otherwise known as PID, as I said. So now pelvic inflammatory disease would be a progression of a sexually transmitted disease, for example, and pelvic inflammatory disease can also be caused by the bacteria that cause sexually transmitted infections, which is gonorrhea and chlamydia. So now with PID, what happens is that let's say you had a sexually transmitted infection, you had a foul smelling discharge, maybe you had that low abdominal pain, and perhaps it never went away on its own, or it never got treated, and then the infection ascends, it goes up into your womb now. And now because there's this infection there, it causes inflammation and swelling in your tissues from inside. And again, if it is not treated, it might cause scarring of your uterus. And now if there's scarring of your uterus, that can end up causing infertility, and you now struggle to fall pregnant because of that prolonged infection that started developing now a complication. So again, over here, because it's an infection, you can have things like that low abdominal pain, you can have things like nausea, vomiting, you can have a fever or a high temperature because it's an infection. Just like with an STI as well, you might be having that low abdominal pain, you might be having the discharge, you might be having a fever, which is a high temperature above 37.5. Yeah, so those are the types of symptoms that you can have with your PID. And then another thing that you can have with pelvic inflammatory disease, on top of the foul smelling vaginal discharge, you can also have bleeding in between periods, or bleeding when you are not supposed to be bleeding, then you'll have bleeding. And also with the STIs, you can have bleeding after sex, bleeding in between periods. So yeah, those kind of symptoms associated with an infection. It can be an STI that hasn't complicated, that's still in your vagina, maybe affecting the cervix a bit, causing you to have some lower abdominal pain. And then if it's pelvic inflammatory disease now, it has sort of progressed, it has developed a complication, the bacteria has moved upwards into your body, now affecting your womb, and it can also maybe affect your fallopian tubes, causing the infertility. So it's very, very, very important to practice safe sex. Be with one partner that you trust. Be in a monogamous relationship with one partner, preferably in a committed relationship where you know you trust this person and you practice safe sex, you know each other's HIV status, and no one is having other multiple sexual partners, and now in sexually transmitted infections are going around, because they can really end up causing a lot more complications in your life that you never thought of, like causing infertility, and at a later stage when you really now want to have kids, you end up not being able to have kids. So PID, second cause in women that can cause low abdominal pain, very serious, definitely needs to be checked out. And then another cause of low abdominal pain is something called endometriosis. So with endometriosis, okay, let me insert that picture of our women's reproductive health system again. So now in the uterus, the womb where the baby is housed when a woman is pregnant, there's a certain type of tissue that is only found there, right? And this tissue is called, or the inner lining of the uterus is called the myometrium. So what happens with the endometriosis is that now you end up finding that tissue that is inside the uterus in other places outside of the uterus. Other places maybe being in your fallopian tubes, maybe in your ovaries. And now when your body goes through the menstrual cycle, for example, on day 1 to 5 of a woman's menstrual cycle, it could be day 1 to 7 for other women, the uterus, it sheds that lining. Because of the hormone estrogen, the uterus, that lining is built up inside the uterus. It's built up so that it can shed itself, and then the woman starts to bleed on those days 1 to 5 or day 1 to 7. So what happens now if that tissue that is inside the uterus is elsewhere on the body, like maybe on the fallopian tubes or maybe in the ovaries? When estrogen stimulates the uterus to become inflamed, or like to grow so that it can be shed, that tissue on the outside areas, it also goes through the same changes. So it also sort of like becomes inflamed, and then when the shedding starts and the bleeding now happens where the woman has a period, it's also going to cause bleeding in those areas, in your fallopian tubes, maybe in the ovaries, wherever that uterine tissue is formed. Then it will also cause the shedding and the bleeding. So now you can imagine women go through period pains when they are on their period, and they'll be having this cramping. So now you are not only having that bleeding and the cramping in your uterus, in your womb, but you also have these small lumps of tissue even outside of your womb that are also shedding, that are also cramping. So now your period pains, as someone who has endometriosis, your period pains are more, they're exaggerated, they are more than a normal person's period pains. So yeah, that's one of the things that cause lower abdominal pain, and they can really just make the whole period experience so stressful for a lot of women. So this pain can range from mild to severe, and this one, it's a chronic pain that you'll probably have throughout your life, unless you have like surgery to remove those tissues that are outside your uterus. But yeah, this is more of like a chronic, longer lasting pain. Perhaps you will feel it a lot when you are having your periods, and maybe sometimes even between periods. That is one of the causes of lower abdominal pain. So now let's move on to the next cause, which is ectopic pregnancy. So now, as I mentioned before, the uterus is the one that houses the baby during pregnancy. So now, what happens with an ectopic pregnancy is that egg that was fertilized by the sperm, it does not implant itself or place itself inside the woman's uterus or the woman's womb, where it is going to grow and become a full pregnancy resulting in a baby. So in an ectopic pregnancy, what happens is that fertilized egg, instead of going into the womb, it stays at the fallopian tubes. Remember, it was released by the ovaries, it travels the fallopian tubes, going down to the uterus where it's going to be implanted. But now with an ectopic pregnancy, it doesn't go to the womb or to the uterus, it stays in the fallopian tubes, and now that embryo starts to grow in the fallopian tubes. Now, as you can see, guys, in the image, the fallopian tubes are very narrow, they're like very small. And now imagine this ball of cells now that's gonna continuously grow, resulting in a baby. It's gonna grow in that small narrow space like that. So can you see how that this thing is just not gonna work at all? So now what happens is that the woman can have the pregnancy there, and then they will have like pregnancy symptoms and all of those things. And that's why it's very, very important. If you start having pregnancy symptoms like tender breast, you start having maybe some cramps in your stomach, you start maybe having, if you start having things like morning sickness, nausea, vomiting, or you miss a period, it's very, very important for you to take a pregnancy test. If you've missed a period, take a pregnancy test, and if it comes out positive, go and see a doctor or go and see a nurse or midwife at a clinic. It's very, very important, because one of the things that has to be done if you are pregnant or when you are early pregnant is that you need to go for a scan, or you need to go for a sonar, so that they can check where is this pregnancy placed? Where is it housed? Is it in the uterus, or is it anywhere else, like in your fallopian tubes and things like that? Because if a pregnancy grows in the fallopian tubes, it can grow and grow up to a point where the fallopian tube, it ruptures, because now this ball of cells is getting so big, the fallopian tube cannot contain it anymore, and it can rupture, which can be life-threatening, and you don't want that. So now if it does rupture, you'll have something like this sharp pain, like this sharp sudden pain that comes. Maybe you'll have nausea, vomiting, fever, those kind of things. So and this can be very much life-threatening, because now you can bleed a lot. You can have risk of infection in the area of your abdomen outside of your reproductive health system, and so you definitely do not want that. Very important to do a scan early on in pregnancy, or as soon as you realize that you are pregnant. Do a scan so that you can be sure of where that pregnancy is. And some people, they might not know that they are pregnant, they might not have any symptoms, but if you have this sudden sharp pain that you just get out of nowhere, definitely do not ignore it. Go and consult. Okay, so another thing that causes lower abdominal pain is ovarian cysts. So now we're focusing on the ovaries, and I said the ovaries are the ones that release the egg, and that's going to be fertilized and result in a baby, right? So this happens every month. One ovary releases an egg on either side of the woman's body, because there are two ovaries, right? So what happens now is that in the ovary, with the ovarian cysts, so the ovaries are supposed to release the egg. There's something in the ovary that keeps the eggs, right? And then when you ovulate around day 14 of your menstrual cycle, the egg will be released. But now what happens with ovarian cysts, sometimes you will have that egg, but the ovary will not release it properly. It won't release the egg properly, or it will have fluid accumulating inside, and now that ball or that lump that has the fluid and this egg, it can grow and become bigger, cause you to have this maybe dull pain on one side of your abdomen, depending on which ovary is affected, and then it can cause you to maybe feel pressure on that side, or you can maybe have some back pain, or what else am I thinking of? Or it can be like a sharp pain as well. And now with ovarian cysts, they can be functional or non-functional cysts that are growing in your body. So functional cysts are these ones that release the egg in your cycle on a month-to-month basis. But then there are other cysts that can form which are abnormal, and they are not related to your menstrual cycle, and they have like funny things in them. Inside the cyst, there can be things like hair, things that look like teeth, fluid. Yeah, so yeah, and now those ones, they don't go away by themselves. With the functional cysts, which come from like your body's normal processes of producing eggs every month, and those ones can go away on their own. And sometimes if you have like a cyst, the doctor will want to like monitor it. They'll do a sonar. It's detected on sonar or on a scan, and then if they are too small, they'll probably be left. But if they are big, and they're causing you a lot of symptoms, then they might have to be removed. So yeah, so another thing with ovarian cysts, they can also cause a degree of infertility, because now if your ovaries were not able to like release an egg, maybe the egg was not released properly, and then you end up developing this cyst, you won't be able to fall pregnant if you are trying to fall pregnant, because no egg was released on that month. And then if you are someone who like constantly has them, you might have problems trying to fall pregnant. So it's also very important that if you have been trying to have a baby and you're struggling, you do need to go and consult a gynecologist. You can start by going to a medical practitioner, or if it has to do with struggling to fall pregnant, I think it's always better to just go straight to the specialist, to a gynecologist. They are more specialized in these things, and they can help you better to find out what is causing your inability to conceive or fall pregnant. So with ovarian cysts, it's also very much important to know, just like an ectopic pregnancy, if an ovarian cyst, it grows uncontrollably, it can also burst. And with the bursting, it can cause you to have infection in your abdomen, or you can bleed, or it can pull on blood vessels and cause bleeding, or it can pull your ovary. If it becomes big enough, it can pull your ovary and twist it, and that can cause a very, very sharp pain. So very, very important, if you think you might have ovarian cysts, or if some people will actually feel like they are pregnant because they're gonna have like this mass growing in their lower abdomen, and to the point that it can even look like you are pregnant. Do not ignore those kind of things, guys. If you are having such growths on your abdomen that you do not know, and you're struggling to fall pregnant, or you're having these dull aches or back pain or sharp pains, definitely get them checked out. Very, very important. So the last thing that I want to talk about now that causes low abdominal pain, it's uterine fibroids. So uterine fibroids are like small lumps of tissue that form inside your uterus. It can be one fibroid, or it can be multiple of them growing inside your uterus. Sometimes if they are small, they might not affect your pregnancy, but at other times, if there's a lot of them or they're too big, they might cause you problems if you are pregnant. Uterine fibroids can cause you to have things like heavy bleeding when you are on your period, or your period can be prolonged. So if you used to maybe bleed for like 3 days, now you're bleeding for like 7 days. So they cause like a lot of bleeding when you are on your period. They can cause you to have like excessive pain, excessive cramping when you're on your periods, or you can be bleeding between periods. And now if you bleed too much than you're actually supposed to bleed, that can cause you to have low red blood cells in your body, resulting in you having a condition called anemia, which is when a substance that's in your blood, your red blood cells called the hemoglobin, falls below a certain level, like for example below 10. So then you have anemia because of that excessive bleeding. So it's also very important to note this. If there's any change in your menstrual bleeding, if you're bleeding more than you used to bleed, or you're bleeding for a longer time or a prolonged time than you used to bleed, or you're having excessive pain during your periods, you definitely need to check it out, because now it can result in other complications, result in you having conditions like anemia. It can cause you to have difficulty conceiving, because now if you're having multiple fibroids in your uterus, where is that fertilized egg going to implant itself? So definitely very, very important to get that checked out. So yeah, man, guys, that's all I wanted to talk about in today's video. I know it was a video that is filled with so much information, but very, very important for women to take note of the things that I mentioned in this video. Practice safe sex, stick to one partner, always know what your vaginal discharge is like. Get to know your normal vaginal discharge. If it starts becoming abnormal, get that checked out. Treat infections. Make sure that you treat infections. Any sharp chronic pain, or any sharp sudden pain that you do not understand, get that checked out. And this is sharp pain in your lower abdomen that you don't understand, definitely get that checked out. Bleeding in between periods, bleeding after sex, painful sex, heavy periods, prolonged periods, those are really things that you really need to be on the lookout of. Do not ignore lower abdominal pain that you do not know where it comes from. And the only way you can find out what's causing pain, especially if you have a pattern, like there's a pattern to this pain that you are having in your lower abdomen, get it checked out. Do not sit with pains that you do not understand, or you're feeling lumps in your stomach that you do not understand and you are not pregnant. Do not sit with anything that you don't understand that's persistent, that keeps on coming back. Make sure you get those things checked out, because you don't want to have something and then it could have been treated and then it ends up developing into something that is more serious now. Yeah, so definitely I think those are the things that I can give you, the tips that I can give you on what causes lower abdominal pain, what are the symptoms that you can have, and what you should do if you have certain symptoms. Yeah, so I really hope that you learned a lot from this video, and please do share this video with other people, and so that they can be able to learn from it too, because this is something that affects a lot of women. I've had a lot of women that come to me and they DM me, or they send me a message and they ask me like, hey, you know what, I've been having this pain, I don't know, or my periods are too painful, or I've been bleeding too much. So this is something that affects a lot of women, and it really causes a lot of distress in their lives. Some are struggling to fall pregnant because some of these things. Some end up in hospital because of these life-threatening complications. So it's very important for women to know about these kind of things and get them checked out and treated as soon as possible. So please share this video, give this video a thumbs up if you enjoyed it, and please don't forget to press on the subscribe button, guys. I need to get this family growing. I need to reach a lot more people so that more women can be well informed about their health. So I really appreciate it when you guys actually do subscribe. Please don't watch without subscribing. And when you share my videos and comment, please leave a comment. Tell me if you ever had any of these things that I mentioned. And yeah, man, I love you guys so much. Till the next video. Bye.